Um, Thank you for your patience, and it's been inspiring the whole evening, and thank you to KidsLink and the speakers. It was interesting because being an arts therapist, it is wonderful to have imagery in terms of how I work. So my name is Mariana. I'm a registered arts therapist, and I trained in the only training program that leads to registration for New Zealand and Australia. And I've specialised in working with children, in particular complex trauma. I think looking at those images, there is a range of settings. Art therapies, or the arts therapist is often adaptable, works well in a multidisciplinary setting with a range of professionals. And I guess in New Zealand it's an emerging profession, but overseas it is well established, mainstream in schools. It is found in schools, which is how, when I did my research in New Zealand, I based my research on a model which was found in the UK in particular, mini art therapy groups. And it was around exploring, or my particular research was exploring the benefits of art therapy in schools for small groups of children with attention, learning and behavioural difficulties. The difference looking at those images, because some of them could be seen as art, an art class, or art for enjoyment or pleasure, as any of us would experience. The difference is really intention, which the next slide will hopefully clarify. And art therapy provides a language, another language for children to express and explore issues. I have come to experience in my work with children now for a few years that if given a chance, they will be able to, we can help them access their own wisdom and their own ability to heal and to do the work they need to do. So arts therapists will work in partnership with their clients, and that applies to 5-year-olds. I work with 5-year-olds upwards, because earlier than that it's usually play therapy that we, as we call it. So arts therapy, it's a definition that I've combined from various sources, integrates the fields of human development and the creative process with models of counselling and psychotherapy. Arts therapy uses creative modalities within a therapeutic relationship, so that's the difference, the intention, to improve and inform the physical, mental and emotional well-being. That's for individuals of all ages. This profession is recognised and regulated, and evidence-based research in the arts therapies is ongoing around the world. So while in terms of New Zealand it is an emerging discipline, it has its own field of study and practice, and it is well established overseas and well respected. It differs from traditional art making in that the emphasis is on the process of creating and meaning making. So in the presence of a therapist who supports and guides, rather than the end product itself. The therapist and client develop a dynamic interpersonal relationship with clear boundaries and goals. So in that sense, it's as a counselling or therapeutic relationship, but it involves another dimension, art making. This is an interesting slide that I brought in particular today because of the subject we've been invited to consider. This is a UK artist who has given form to a range of conditions, depression, anxiety, and that includes mental illness, such as schizophrenia. And his purpose was to dispel the myths around some of these conditions, to make them accessible. So while some of them look like caricatures, it is really encouraging people to tackle these issues, to remove the stigma, and to assist, when it comes to children in particular, to address or personalize the experience. So as a therapist, for instance, I'd be looking to see how a child is experiencing anxiety in their own unique way. So arts therapy, to put it again in context, it's around self-exploration and self-expression, and it's very much looking at the individual experience. So the art has created a range of characters, and by giving them form, he is intending to have us accept them as part of life. These conditions are part of life, but we can learn to work with them more readily. We'll go on, thanks. So arts therapy and anxiety. Arts therapy is an effective partner in a multidisciplinary setting, which these days we are encouraged to do, to work with other professionals, and especially when it comes to children. Several professionals are involved. There might be an educational psychologist, there might be a medical practitioner, there might be an RTLB and others, many others. And arts therapy, because it's very adaptable, it functions well in a multidisciplinary setting, and yet it is a separate discipline. Now, art and creativity support the healing process. The reason how it does that is by assisting the client, say, to externalize the problem or issue, giving it shape. It could be through clay, it could be through drawing, through paints, through movement. There's a range of modalities and options. And a client's or a child's natural way of solving problems is through play and creativity, and assisting them to develop imagination. So they find their own unique way forward. Arts therapy also assists a child with anxiety in terms of accessing the underlying cause, because with children and anyone in a therapeutic environment or setting with a therapist, defenses can come to the fore very easily and very readily. And we find ways to hide, consciously or unconsciously, the real issues. But art reveals all. And also the act of being creative for the child, again, its natural way in the world, provides relief from the symptoms. One of the areas that has been researched is around neurobiology, and it has been established, there's a lot of research going into these areas and into the arts therapies, that creative activity increases brain levels of serotonin, which is the hormone associated with good feelings of well-being, and gives rise to the alpha brainwave patterns seen in a relaxed, alert state. So there is very real research indicating that working with anxiety with children, the mere act of engaging them creatively is already leading them in the right direction. And a recent case is a client of mine who's came to see me with generalized anxiety, and there's lots of situations in life where it's becoming quite a problem for her. She can't consider sleepovers, she worries constantly that her parents will die, and these are the issues. Now, for the child, it's a serious concern, because as they come into teenage years as well, this child is 12, it affects their future, their lives, their hopes and dreams. So she came and immediately engaged creatively, working creatively, and a lot of the nervous tics and nervous presentation, observing her presentation and her how she presented in the session, I saw her coming down gradually through the session as she worked creatively. And it was only after 2 sessions that her mother reported changes in the way that she reacted to regular situations that in the past would have escalated her behaviors or her symptoms. So it has real potential for making a difference even after 1 session. And I do combine, when I work with anxiety, practices that have been mentioned before, such as body awareness, visualization, relaxation exercises, mindfulness, and I will work with the family as well, because we're talking about family systems when we're talking about working with a child. The work is client-centered. I think we can go on to assessment. The work is client-centered in that we, as I've said before, I will work with what the client brings and how they experience anxiety. And a child in a supportive environment will find their own way. Assessment includes, in how I work, parent and child interviews. The process can take 4 to 6 sessions. It will include an art assessment, and as you can see, there is one there. And while an arts therapist doesn't actually interpret, the client, the child, is actually the expert. It is a partnership. I can hold wanderings and seen themes that are emerging or concerns that are emerging with the child that are often unspoken, and sometimes the child just doesn't have the language to put this forward, to put the real issues forward. So the art will start to reveal, and it goes on to towards dialoguing. So that one obviously is, as an example, an art assessment that will say, I can ask a child to describe a day, what the weather's doing, and that even something simple as that can reveal how they're feeling about themselves. Another common art assessment is a family drawing, and many may have heard of that. Once more, it can reveal a lot about family dynamics and the child's place in that family, within that family, and sometimes the deeper issues emerge, which are really at the core of their behavioral presentation, which might be anxiety, but it might be something else that's underneath that. Because often with anxiety, there are several other, issues, or there might be other conditions. There might be depression alongside anxiety. So in terms of assessment, looking at parents and children and family dynamics, the assessment will include a child doing a free drawing or free expression, because that's when they will reveal what's really happening for them. I might suggest an art assessment like the one that's up there as an example. And I look at developmental history as well, and major events in the child's life. Thank you. And in terms of the treatment, because we're looking at a child exploring through art and finding a way to communicate through art what is happening for them, no art experience is required. It is about self-expression. An individual treatment plan will be tailor-made. I heard that mentioned today. It's about working with the child and what it is that they actually need, not what I think they need. So the treatment plan will evolve from the discussions with the child herself or himself and the family, sometimes the school, so it's inclusive. And the modalities that I particularly work with are drama therapy techniques, art therapy interventions, sand play therapy, which is also very powerful, working with symbols that convey more than words often can. And art therapy is powerful because it does tap into the unconscious, which really gets us to the essence of the problem very quickly. And it enables destructive aspects to be transformed by working with the healthy aspects of the child's personality. So it's really accessing the wisdom that the child brings and the healthy aspects of the personality without pathologizing, and understanding what the child is really experiencing so we can move together with that. So it's really, in a nutshell, a little introduction into arts therapy, but the scope is huge, and tonight, obviously, I can only offer an introduction. It never ceases to amaze me, though, how children know what they need to do in therapy, and they just need the opportunity, the space, and the encouragement. And art therapy really conveys that we don't need to, it doesn't have to be a struggle to achieve healing or a positive outcome. It can be through play, it can be through creativity, it can be through a positive interaction with their therapist, that they can find ways to discover their own abilities and develop their own potential. So thank you. Thanks for the imagery.